Office and the Verde Valley Senior Center. We're going to start things off this morning with April Rhodes from Spectrum. Thanks, April. The floor is virtually yours.
Awesome. Thank you, Mayor. Oh, good. Sandra made sharing the screen available. Let me pull up. So can you all see my screen okay?
Yes.
Okay. Well, thank you, Mayor and council members, for having me this morning. I appreciate it. I know we have limited time, and so in the interest of time, I'm going to assume that most people know who Spectrum is and what we do, but just in a nutshell, we're a full-service physical health and behavioral health county-wide provider. We provide the full spectrum, pun intended, of services, including mobile crisis response, residential treatment, outpatient physical health, and behavioral health. For today, I wanted to update you on two specific areas. Obviously, we couldn't escape any meeting without talking about COVID-19, probably. So I just wanted to give you an overview of some of the COVID-19 testing numbers that we've seen countywide, and then both for countywide and for the Verde Valley. So this chart that you're seeing represents our COVID testing numbers since the pandemic began, since Spectrum started providing testing, and then on the right-hand side is more Verde Valley specific. So over the course of the pandemic, you can see we've provided 14,640 tests. And then it has basically the positivity rate broken out there. So overall, throughout the course of the pandemic, it's run about 5.89%. But just in the last 2 weeks, it's been about 16.2%. As you all know, we've experienced increased spread. Everybody's definitely heard about that, I'm sure. In the Verde Valley specifically, you can see here that we have provided in blitz testing. If y'all recall that we did the governor's blitz testing a couple different Saturdays, both in May and then August. And during that time, we provided 1,659 blitz tests. And then we've also provided in the Verde Valley the community-based testing, which is basically when we go on site to a provider or to a partner in the community and provide site-specific COVID testing. So we've done that for different partners like, Clarkdale PD, Cottonwood PD, the city of Cottonwood. We've done that for YCSO. There's been quite a few partners. One of the other things that, apparently I have to click, there we go. One of the other things that we've recently launched that I just wanted to give you an update on numbers is our curbside care service. And some of you may be familiar with your ability to pull into our Mingus location in Cottonwood and pull into a curbside spot, which we've had to expand from 3 spots to about 10 spots marked with orange cones instead of our fancy signs because the demand has been so great. But these are the numbers basically for what we've provided in the Verde Valley just since launching curbside care. It's been 2,656 people seen at the curb. So it's incredible volume and demand for that testing. That includes the rapid testing while we had supply, as well as the send out testing that we generally partner with LabCorp for. I know y'all are going to want to know about an update on rapid test availability, I'm sure. And so we do have those supplies coming in again. As you can imagine, across the country, there's a high demand for rapid testing. And so we're kind of in the queue to get those. We're only allotted a certain amount per month that we're able to get a hold of. And then when we do get some, we try to earmark some of them for skilled nursing facilities, for, like our partners at the jail, because those are high risk environments. So we want to make sure we have enough to serve those community partners, and then we open up to the community. So we should be able to provide more robust rapid testing here in the next week or so. The other thing I'd like to update you on briefly is our mobile crisis response. Hopefully many of you are familiar with the mobile crisis response that Spectrum provides countywide. And so basically, in a nutshell, we respond 24/7 in real time to all areas of the county, to people calling from the community, to law enforcement on the scene, to first responders, EMS, just essentially anyone who needs a crisis response. Countywide, we've seen, this is covering a 12-month period, so up through 11/30 of 2020. And so Countywide, we've seen 2,695 crisis response events, as you can see. Our mean response time across the county is 25 minutes. I did break it out for the Verde Valley so you could see the response specific to those areas. And so we've seen about 1,800, a little over 1,800 crisis response. And interestingly, the third bullet there, the 296 individuals have multiple crisis events that account for half of all our crisis responses in the Verde Valley. So that's just we find that an interesting number. So we have quite a few people that we see pretty frequently. But our mean response time in the Verdi tends to be about 21 minutes, which, we're pretty proud of because it's a large area that we have to cover and we're still able to maintain that rapid response time. So we always like to share that. Again, just some specifics, and I have lots of information if anyone's interested later about the breakout of data, related to who we're responding to, where those referrals are coming from, things like that. But the average age tends to be about 41. 28% of our crisis events involve substance abuse. As you can see, we have about 5%, and this is specific to the Verde Valley, so this is not countywide, although I have those numbers as well. But they involve a serious mental illness. We see some homelessness, and another number that we're proud of is that 72% stabilized in the community. And what that means basically is that we're responding in real time to wherever the person is, and then 72% of the time we're able to keep them either in their home or wherever it is that they're living, or we're able to find some sort of housing need or housing resource to meet a need if they don't have somewhere to be, about 72% of the time. The rest of the time, they may need a higher level of care, including psychiatric inpatient or detox or something of that nature, and we're able to connect them to those services as well. Estimated cost savings in the past 12 months just for the Verde Valley is about $12.9 million. Again, this is an estimate. It's difficult to prove a negative, essentially. And so we have to do some speculative math to come up with this number. But basically what we're saying is that if we avoided, an ED visit or an arrest, then this is the savings that would come out of that. So it usually runs about $12.9 million for the Verdi, slightly over that countywide. So I wanted to just share with you too, as I wrap up and hand off, just some of the challenges we're seeing right now to make you aware of is that we continue to be overwhelmed on the outpatient side, just in terms of COVID testing. And so, we've put out some strong messaging. I sit on the Board of Health for Yavapai County, and we've tried to really encourage elected officials countywide to encourage their communities, again, to, try to stay home, try to just be very careful, washing your hands, wearing the masks if you're out and about, if you're high risk, just really being careful around that because we're seeing incredible spread over the last 3 weeks. And it's overwhelming. When we start to feel overwhelmed on the outpatient side, we know that that's going to, that's going to show up in the hospital system. And so we've seen, obviously very limited spread throughout the pandemic in Yavapai County, but this last couple of weeks has been very concerning. And then the last thing that I would say is, with mobile crisis response, we continue to be underfunded in mobile crisis, and we continue to provide that service at a loss. And so we have a partnership with Verde Valley Medical Center and Northern Arizona Healthcare, which has been incredibly helpful, but we're always looking for additional support in our mobile crisis response because we think it's a very valuable service. It provides a lot of value to just across the system, community-wide, and so we're always looking for additional support with that. So with that, I don't know how to stop sharing, or maybe Sandra took it away from me.
Thanks.
Which is fine.
Thanks, Ms. Rhodes. We're going to hear from our other panelists. Ms. Rhodes, we will hear from our other panelists, then we'll open it up for questions at the end, okay? Thank you very much. All right, next we have Ron Hasse, who's with us here today from Verde Valley Medical Center.
Good morning, everyone. I'm Ron Hasse, and I'm the Chief Administrative Officer over at Verde Valley Medical Center and oversee all of our functions down here in the Verde Valley. Thanks for having me. I'm just going to speak with you from some notes I have versus a PowerPoint. I hope that'll be okay with everybody. So let me talk a little. I've been down here for just over a year. And I came down in November 1 of last year. I've actually been with Northern Arizona Healthcare for about 5.5 years now. So probably just as you just heard, one of the things that's obviously captivating our time and attention and concern is COVID-19, the coronavirus. I would tell you back in the spring, we went for quite some time averaging about 2 to 3 positive inpatients for quite some time. We all speculate why that is. And one of the things that we believe is that because our demographic does have a geographic spread where we're at, we benefit from the population demographics. And so we were able to stay at 2 to 3 a day for quite some time. In the early summer, we spiked up to 21. And that, of course, was a concern for us. It came down after that, probably in the latter part of July, and we stayed at somewhere between 1 and 4 for the remainder of the summer. And then just a matter of a few weeks ago, we started to go up on a steady pace until we got to 29 about 3 weeks ago. The good news is we've come back down. As of this morning, we're at 21, and the census of the hospital is down, and that's an important item as well. Because of the state mandate, we have to watch our surge capacity and that we not bump up too closely to our surge capacity, especially if we're going to have elective surgeries today or non-electives that will require inpatient stays. And that magic number for us is 69. That's 80%. And so when we start to bump up against the high 60s, we start to take a close look at our surgery schedule and who needs to stay and who may not need to. And of course, you have to plan for surprises of people that just come into your emergency department. So we're down. That's the good news. We weathered the storm as many did, obviously, in terms of PPE. And I would say right now the words that we use internally is that we're solid. You don't want to get too euphoric about that because none of us really know what the future brings. But right now we are not in the situation we were in the fall where we just got slammed. And our average usage for masks like these on a daily basis is probably about 5,000. And when we hit the peak of the beginning of the summer and then more recently, we're probably using 25,000. The other thing about PPE, because it's a commodity like anything else, you might spend about 50 cents on one of these normally, and today you're spending a lot more than that. So it's just a supply and demand economics. And so that's where we're at right now. Elective surgeries, early in the summer, we backed off on electives because we were mandated to do that. We are not in that space right now, but we sort of worry about what will happen in the future if we have high census. We could get a mandate that says we'd like you to back off of those. I get asked every day, I'm sure like all the other participants, all kinds of questions about the vaccine. We anticipate getting vaccine, and we think it's coming from Moderna. We'll know that for sure when it arrives on the doorstep, because you don't know. And we are told that it should ship and be received by us the week of Christmas. Right now, the only instructions we have are that we are to make sure that it gets administered in accordance with CDC guidelines for, who's in the first wave, second, and third, to our people. So we do not currently have a role, any other role in the community or the county for providing vaccines, injections. Right now, there is a phone call going on with Yavapai County where that could change. And so this afternoon, you could get a different message where we've been asked to do something. But right now, our message is to administer to our folks. And as you've probably read and heard all over the news, Moderna is a 2-injection sequence, 4 weeks apart. The good news about Moderna is that it does not require the storage that the Pfizer product does, which would have created some real logistics and challenges for us. So that's where we're at. Yeah, staff. I like to talk about the staff because they are really the heroes of what goes on in our business, and I will tell you they're tired. Imagine if you work on a COVID positive unit, and every patient you go in to see, you have to don a new set of PPE. So that means you need a new mask. In fact, you probably need 2 masks. You need a gown, you need gloves, et cetera, to go in there. When you come out, you have to take all of those off, and before you go in to see your next patient, you have to put a whole new set on. And that goes on for our nurses working on those units every day, multiple times a day. One of the things that's different about COVID for our nurses is that in our industry, which it is an industry, when a patient is about to expire, what typically happens is a physician, the attending physician, whoever that may be, is summoned to the room, and the attending physician typically is present as that patient expires, and then also speaks with that family about that occurrence. That does not happen today. In the COVID world, you have a nurse that's in that room who's oftentimes holding a laptop up to a person who might be able to utter a word or two so that their parents or their loved ones can hear them during their last moments. And we have been paying attention to our nurses and our other attendants very carefully because it is a terrific emotional drain on them. They're doing as well as you would expect, and none of us know how much longer this will go, but it is something that we pay attention to and have devoted a lot of resources to try to take care of their mental as well as their physical health. I'll just mention one other thing because we ought to talk about something that's positive other than COVID, and that is in terms of future. We have been working on a master facility and services plan for probably the last year and a half, and part of that obviously involves the Verde Valley. And we think that there is an opportunity and a need for an ambulatory surgery center down here in the Verde Valley. And we have started doing research on that. I would expect that sometime in the next 9 months we will have completed that and we'll have started to think about where that might be and where it might go. What we have found in a lot of our data analysis is that the Verde Valley, and specifically the Cottonwood, Camp Verde area, tends to be sort of an apex area where people have been willing to travel here for their health care, even as far away as Prescott. You probably know we have a breast center in Sedona, but we do our surgeries here. And over the last year, 31% of all of the surgeries we've done came from Prescott or Prescott Valley. So at any rate, probably if you said, when do you think something might happen, I would say sometime in the next 2 years, we would probably have a new surgery center somewhere here in the Verde Valley. And I'll just stop there.
Great. Well, thank you. That's good news. Thank you. All right. Yes. Okay. Okay, hopefully folks can hear me out there that we're going to have a brief pause here before we go on to our next speaker.
I don't have an answer for that yet. I wouldn't dismiss the possibility, but I don't know the answer to that yet.
Where's the next likely place you would locate that? Flag or?
Probably the only two places that are really in consideration would be either Cottonwood or Camp Verde.
Okay.
Structure. You don't have room in the Camp Verde campus.
That's correct. Yeah, it would require a new structure. Yeah.
Camp Verde's that town to the.
Ms. Rhodes, can you hear me? Can you give me a thumbs up if you can hear me? She's nodding yes. So it sounds like our sound's back on. Matt, are we good to go, you think? And one more nod there, Ms. Rhodes.
We can hear.
Awesome.
Great.
Okay, we're ready, sir. Thank you for the pause.
All right. Let's move on then to the Verde Valley Homeless Coalition. I believe we have Carol Quazula with us today. Good morning, Carol. We can't hear you.
Here we go. How's
Perfect.
that?
Perfect.
Okay. And we also, Rhonda Bishop is joining us as well. So she's had some difficulties hearing, but I think the problem's been on your end. So hopefully we'll get all of that cleared up. But anyway, thank you, Mayor, council members, for inviting us to attend this community health and wellness this morning. Verde Valley Homeless Coalition, we have been in operation going on 3 years. We serve the Verde Valley homeless. Our services are to provide a drop-in center, and we provide that service Monday through Friday, 1 to 5. And then we also provide emergency overnight shelter when the temperatures are 35 degrees and below. And we have been opened, I believe, the last 8 or 9 days. And with the weather changing, we're anticipating the end of this week we'll be open again. We have up to 20 beds where we could provide shelter. And we're filling those about, I would say we're averaging around 10 individuals a night. One of the things that the center, I think, does exceptionally well is just really meeting everyone at a very individual level, assessing what their needs are, and then directing them to services. I would say, you know, from my estimation, probably 90% of those we serve are also receiving services at Spectrum Healthcare, which is a wonderful partner. I don't know what we would do without them in providing ongoing services, but many of our individuals struggle with both mental health and substance abuse issues, and then of course in and out of the jail system, and we'll be hearing from Jeff later. Some of the challenges we faced, you know, like with everyone else, COVID has definitely set us back in terms of volunteers. Many of our volunteers were in that high-risk population, and just even though they believe in the service and miss being there, they just needed to do that for health reasons. We certainly are following all of the COVID guidelines, city and state. And knock on wood, we have not, to our knowledge, had a positive case. And we do temperatures, and we certainly send them for testing whenever, you know, we suspect that possibly there, you know, could be a virus. So, but so far, so good. And as far as numbers served, I Rhonda was to do that. So I apologize that I don't have those right in front of me. Rhonda, are you on now? Okay. All right. So I apologize that we don't have that, but we are serving, anywhere from 15 to 20 on any given day in terms of our day services.
All right. Thank you, Carol. Were you able to get Rhonda unmuted, Sandra? Ms. Bishop, I'm not sure if you're on or not, if you're able to speak at this time. All right, well, we'll go ahead and move on then, Carol, if you're wrapped up, and we'll ask questions
The only other thing that I just wanted to let the council know, Mayor obviously is on our board, so he knows, we are moving towards a full-time shelter. And we're working with city planning and zoning. We'll be submitting our paperwork. As you well know, it requires a sprinkler system. And we have had some generous community donors that are helping us with that. So that's our direction. And reason being is that we all know that housing is, at least affordable housing for our folks, is just really very difficult to get. So even though folks get on their feet, they remain homeless because they don't have an affordable place to move into. So we're definitely gonna move forward with offering a full-time shelter, and we also would like to in the future increase our services to do more homeless outreach, because it's amazing how many people in the community do not know the services that we offer.
Very good, thank you. Let's go next to Jeff Newman from the Yavapai County Sheriff's Office. Mr. Newman, it's a pleasure to have you here. Thank you so much for your time.
Thank you, Mr. Mayor, council members. Thanks for having me. I thought I'd just speak a little bit about what our current criminal justice system and our detention center specifically looks like. I know I've been asked to speak a little bit about what we are seeing and doing with the mental health population that is coming through our detention facility. And so what a lot of people don't really understand, because they're not involved in it, and we get a lot of questions about what does the jail look like? What does our jail look like in Yavapai County? And so what I like to tell people is we have one major jail in the Verde Valley, our detention center that's off of Highway 260. And then we have a small intake facility here in the Prescott area off of Gurley Street that used to be our main jail, which only has about 130 beds. And those 130 beds are used for court holding right now, because 60% of all of the criminal justice cases that come through the Yavapai County criminal justice system originates here in the Quad City area. So, most of the trials happen over here at the downtown courthouse, and we have to bus about 70 to 80 inmates on 3 days a week to come over here for those trials. But our detention center over in the Verde Valley is 644 beds. And with that 644 beds, we have an operational capacity of 515. And what that means is we have to be very diligent about what we call classification. For instance, we can't mix males with females. We can't mix your hardened criminal acts with somebody who's in there for a misdemeanor DUI or a trespassing or something like that. We can't mix gang members. We, on any given day, have about 40 to 50 inmates that are what we call house alone. And what that means is they're so violent towards other inmates and the general population that if we put somebody with them, they will harm them or attempt to kill them. And they make it very clear. So those 40 to 50 inmates take up 2 beds each. So that's between 80 and 100 beds that are taken up by just 40 inmates. I have an entire dorm that's full of, and each dorm houses about 30 inmates. So we have an entire dorm full of people that are in on murder charges, for instance. I have 2 dorms full of individuals that are in on serious sex offense charges. And this is what I like to educate people on, because it's really important to understand the makeup of our jail and what the makeup of the inmate population is. Because I think a lot of us are able to live in a fairly peaceful way out in society, and we're not victimized and whatnot. And there's been this narrative out there that if our jail is full of misdemeanor marijuana charges and just simple drug charges, and that's really not the case. What I like to illustrate is that on any given day, our population is 97% full, or our 97% of our inmate population is in there on felony charges, serious felony charges, or mixed felony and misdemeanor. We average about 700 bookings per month into our facility. About 350 of those bookings are for serious felonies, and about 150 to 200 are booked in for misdemeanors, but those misdemeanors only stay in our facility long enough to be processed, and then they usually bond out. So only 3% of our population right now are in our custody for misdemeanor charges, and a lot of those are statutorily required charges, such as domestic violence or DUI or something of that nature, where they have to serve a certain amount of days. Domestic violence incident has to be in there for at least 24 hours statutorily. A DUI could be in there statutorily for 24 hours up to 5 days or 10 days. So that's what our jail population is made up of right now. The other important factor that we identified in 2016 was the fact that our jail was extremely overcrowded. With our operational capacity, our jail was overcrowded, and we identified the fact that many of the inmates were repeat offenders. They were coming back time and time again, same inmates. And so at the time, the jail commander, who was David Rhodes, who is our incoming sheriff, and our current sheriff, Scott Masher, they did a study with Wexford Medical to see if we could predict the recidivism of those inmates that had a mental health issue, for instance, because at that time, over 50% of our inmates suffered from some sort of mental health issue. Over 30% of those inmates were actually taking psychotropic drugs of some sort. So what we noticed is they were coming back, being booked into jail repeatedly for new charges, and then going back into the community and committing a new crime. And so what the jail commander at the time, David Rhodes, identified was that we really were not connecting anybody to care once they were released from our jails. And was there a way to identify what the risk factors were, and would we be able to do a warm handoff or connect them to certain care to help them be more successful on the outside? And so we identified 70 inmates. We took 70 inmates that we thought were high risk. And we identified, we predicted that all 70 of those inmates would come back within 3 months. And sure enough, they did. All of them came back. And so through this concern, our mental health coalition was formed. We identified certain stakeholders that we partnered with to start speaking to what could we do to start connecting people to care. And that's how the reach out diversion, the reach out initiative was born. And so long story short, over the course of 4 years, we have developed partners with Spectrum Healthcare or West Yavapai Guidance Clinic, US Vets, Angie's House in Cottonwood, with the prosecutors in the limited jurisdiction courts, the county attorney's office, the public defender's office, anybody that we could identify that would have a stake in getting someone connected and keeping them on the right path. And so by doing that, we created the Reach Out initiative. And so our Reach Out program inside the jail is made up of 11 employees that we have that work full time. And every time someone is booked into jail, they are interviewed by these individuals. and those risk factors are identified. And it could be anything from a mental health issue to a substance abuse issue to the fact that they don't have housing on the outside. So there's a transitional housing issue or transportation issue, a voc rehab issue. Whatever that might be, we identify what that risk factor is and then look for a partner on the outside, contact that partner, do an assessment that we can give to the judge so the judge can see what that risk factor is and then link them to care. And so when we have a release date, and the jail is a little bit more complicated from a prison system where you have somebody in prison where you know when they're going to get released. In the jail, it's fluid. They could be released today. They could be released 2 months from now. They could be released 2 years from now. So we have to be ready. So that's why it's important at the onset of their intake to interview them, identify the risk factor, and then make those connections based off of assessments that are done by our mental health, our behavioral health, our primary care physicians. We identify those, we make those connections, and then once they're released, there's a triage that takes place. Spectrum Healthcare is doing that for us right now, and these people are taken and done and given to these providers, whether it be in Prescott or Cottonwood or wherever. We've actually transported people to Peoria, to Parker, wherever we can identify and help somebody start off on the right foot upon release. And we're not talking about everybody. Obviously, there's certain people that come into our jail system for serious felonies that should never get out. And we're not talking about those folks. We're talking about the individuals that are committing low-level felonies or misdemeanors that we know are going to be released into our communities. So if we know someone's coming back into our communities and we can get them the help they need to make them as successful as they possibly can, to maybe divert them from the destructive behavior, we felt in 2016, and we've seen it in the last few years, we felt that that recidivism rate would drop. And so in 2016, our recidivism rate was 39%, which was on par with the rest of the state. And around the state, 200,000 inmates are released from our jails in all 15 counties every year. And so the recidivism rate was pretty consistent across the board at 39%. In the last 4 years, we have seen through this program and partnering with the city magistrate in Cottonwood, for instance, on misdemeanor cases and whatnot around the county, that the recidivism rate has dropped to 16.4% right now. And so we keep all of those stats through third-party hand. NAU has helped us. We've had the Wellington group come in and study to make sure that we are seeing and identifying correctly the numbers that are coming in. But we also have another piece of equipment that gives us the true representation, and that's an iris scan system through BI2 technology. So every time someone gets booked into our jail, they get iris scanned like you would get fingerprinted. And we share that data with multiple partners around the nation, and it's ran. And so what that does is it tells us who's been booked in, when they're released, and if they come back on new charges. And the data from the iris scan for this year in 2020 also shows that our recidivism rate has dropped to 16% in Yavapai County. So that's only possible through the partnerships that we enjoy around this county through the stakeholders that are involved in the Mental Health Coalition, the city of Cottonwood. Right now, the city of Cottonwood, and I just wanted to share this with you. You may not be aware of this, but every month, Cottonwood Police Department books in on average, about 52 individuals into our jail. That's about 8% of all of our bookings each month. So if we partner and we're able to keep those folks from coming back and reoffending, that number hopefully will drop for you. So hopefully over the years, you see a decrease in the amount of people that you have to book into our jail on new criminal charges. So that's kind of where we are in a nutshell, but I will end with this. Our jails we're still at operational capacity. Our average daily population for the jail pre-COVID was 570 inmates. That in our operational capacity is 515. So we're usually 50 inmates over our capacity. With COVID, we've had to slow down the bookings of misdemeanors to where we could create quarantine dorms and we could socially distance some inmates to keep them healthy. I'm happy to say that our county and Yavapai County is one of the more healthy counties as it relates to the jail environment. We've only experienced 9 inmates since the beginning of COVID that have been positive, and many of those inmates came to us, were booked in with COVID, and we knew that they had them, so they went into negative airflow cells immediately. And so we've been very fortunate but that's been the partnerships with the courts. We've actually had to slow down trials, we've had to slow down the criminal justice system for prosecution because of COVID. So our daily population has decreased. We've been trying to get it down as much as possible. But after COVID is over, we fully expect when we're back to normal that our daily population will be back over 600 inmates. With that comes the need for the new Criminal Justice Center in Prescott. And the new Criminal Justice Center in Prescott is a co-located facility. It's not just a jail. There's only about 152 beds being built for inmates in this new Criminal Justice Center. But because of the population in Yavapai County has increased to 250,000, we're mandated to build a new Superior Court Division. So this center will have that new Superior Court Division. It will have a mental health center that will facilitate all of our partners in reach out. So when someone gets released, they will immediately go to this center and be connected. It is also going to be a center that is going to deal with the Title 36 population, which is the involuntary commitment and housing of those that are either a danger to themselves or others. But the new Criminal Justice Center will only focus on those individuals that are being booked in the Quad City area. We'll keep them for 2 weeks through the early disposition court process. And then if they stay longer, they will end up going to the Verdi jail. So, you hear all of the narrative about a new jail. It's just all about a jail. It's really not. It's about bringing the resources that we lack on this side of the mountain in the Prescott area that currently we enjoy in the Verde Valley with the jail and all of the contacts we have there. I will tell you this, our officers that work in Baghdad, Ash Fork, Wickenburg, because some of the Wickenburg areas in our areas, along with Prescott PD and Prescott Valley, every time they take somebody to jail that has a medical issue or is combative that cannot be booked into Prescott, it forces them to drive over to the Verde Valley. And that takes our officers out of our communities on this side. We don't provide the resources adequately right now for the Prescott area. So it is with the population booming and the 10%, what we're seeing is a 10% increase in population every year to Yavapai County. Well, our jail population is also increasing 10% a year in Yavapai County. And so this has been a venture that we've been addressing for more than 10 years. I know Sheriff Masher, and that the land was purchased 20 years ago just to be able to build a new facility over in this area. So that is really, in a nutshell, I'm trying to wrap it up for you, but that's what our Criminal Justice Center looks like. That's what is going on in our jail. And I'm happy to answer any questions that the board might have of what we're doing and why we're doing it and why we're seeing what we're seeing.
All right, thank you, Mr. Newman. That's very informative. We're going to hear from our last panelist, and then we'll open it up for questions for the entire panel. So next we have Elaine Bremner from the Verde Valley Senior Center. Good morning. Thanks for being here. And you're muted, ma'am, so you got to... We still can't hear you, Elaine. Are you able to unmute? There you go.
Yeah, here you go. I had a quiet moment. Usually you want to mute me, don't you? Anyway, thank you very much for inviting the Verde Valley Senior Center to participate and give input at your strategic planning retreat. We all know we're in a crisis. I'll just get right to it. How did we respond to the first wave of coronavirus? Well, due to the pandemic, on March 16th, of this year, the senior center closed its dining room and began serving takeaway meals at the door to those who had normally frequented our facility. Now, from April 1st through June 30th, we provided enough food for 2 meals a day, 7 days a week, for all home-delivered meal clients, as well as the takeaway meals at the front door. So we ended up serving 38,446 total prepared home-cooked meals to all communities throughout the Verde Valley during that 3-month time frame alone. Now, that was an increase of 25,677 meals more than the same period of time last year. Now, in Cottonwood, in the same 3-month period, we served, as Cottonwood alone, 16,987 meals. That was 11,038 meals more than the prior year. So you can see we haven't been sitting around. Under normal circumstances, senior centers face many challenges on a daily basis, but the overall impact of COVID-19 virus on our operation is without a doubt overwhelming. The crisis has found implications for the food system, profound implications for the food system and for many people's ability to access food, including older adults and others most vulnerable to the virus. Now, this spike for demand has arisen in the context of deep cuts to services seen as nice to have rather than essential, despite the needs met by our program. Many older adults do not have the resources required to deal with the stress of COVID-19. This may include material, social, or cognitive or biological resources. For example, lack of access to smart technology, few family members or friends, inability to engage in physical exercise or participate in activities or routines, especially outside the home. Of particular importance is the role of technology, which has emerged as an integral factor for maintaining social connection as well as accessing health services. Older adults are more likely to have dire outcomes from effects of the virus, not to mention exposure to or infection of. Meals on Wheels is an emergency response community feeding system. We're exercising every precaution to minimize the impact of COVID-19 on the vulnerable seniors that we serve and to ensure the safety of our employees and volunteers. Our work in providing Meals on Wheels helps to ensure the safety of vulnerable adults in all communities of the Verde Valley. For 41 years, we have successfully served thousands of seniors who are unable to shop or prepare food for themselves due to physical limitations and/or financial difficulties. That being said, the numbers are not on our side. Not only is the senior population projected to explode in the next few years, but the disastrous ongoing effects of this pandemic puts this vulnerable group in even more danger. Demand for Meals on Wheels has grown tremendously, even without the added impact of the virus. Food costs have risen and are still rising. Food and supply items that were the norm are no longer available or substituted by an item that is twice the cost. Hand sanitizer is an additional expense to our budgets, is blowing it. Masks are an additional expense. Food packaging materials have been in short supply and the cost has risen. Labor is more difficult to find than ever before. Volunteers are in short supply more than ever before. Fuel costs. Oh, let's talk about that. We traveled 10,000 miles more this year over the prior year. In short, we have and still are experiencing food shortages, price increases, late deliveries, no deliveries, constantly making menu adjustments, and our administrative staff are prepping food and packaging meals, and we're in need of home-delivered meal drivers and volunteer help, not only in our dietary department, just throughout the facility in general. Meals prepared at the Verde Valley Senior Center are currently being delivered 3 times a week and are delivered hot, cold, and frozen. Some clients are eligible for 7 meals a week, but the majority receive 5. The Home Delivered Meals program is dependent upon volunteers to deliver meals, and waiting lists can be long. How are we responding to the second wave of the virus? Well, to meet the sudden reappearance of the virus, the Senior Center is about to return to serving 2 meals per day, 5 days a week. Negotiations with NACOG are underway. It's my understanding that they will partially reimburse for the second meal, and the main meal is only reimbursed at the following rate. NACOG, according to my contract with them, will reimburse for the first 1,011 home-delivered meals at the rate of $9 a meal. It costs us more than that. It's a partial reimbursement. We're currently serving close to 5,000 meals per month. That leaves the Senior Center holding the bag for close to 4,000 meals per month that are not covered by any funding. That's appalling, isn't it? Now, due to the pandemic, we're unable to hold fundraising events at our facility. And compared to last night, we're realizing a huge loss. To date, approximately $30,000 in annual revenue from facility rental fees, events, etc. Now, compared to last year, donations are scarcer, slow coming in, and client contributions for meals are few and far between. And due to the pandemic, waiting lists for Meals on Wheels are rapidly climbing. I was informed today that we have 22 more seniors who are on waiting lists for Meals on Wheels. We shall rise to the occasion. We're also dealing with another separate lot of seniors who are considered to be fast emergency cases that with NACOG, and we're taking care of that situation as well. We always rise to the occasion. I think you know that. So, and due to the pandemic, our veterans are without a home, those that come here normally for counseling. ARP tax aid came to a quick close. That nurses training program that I have here in partnership with NAU has ceased for the moment. So we have all of these adverse effects on the overall facility. Now, for a community already suffering from severe loneliness and isolation, the dangers of COVID-19 for seniors extend far beyond the physical. Now more than ever, seniors need food, safety, and emotional support. And I might add, toilet paper. I had to throw that one in because you need a laugh about this time. They need us, and we need you to advocate for seniors. We need support from the City of Cottonwood to recognize the value of our senior citizens by reinstating the Verde Valley Senior Center as a line item in your annual budget. Help us survive. We are meeting the increase in demand, but without an increase in funding, I fear we will not long endure the financial deficit that is inevitable. No qualified individual is refused service by us. That is our commitment to this community. We are on the front line, as many of you are that are present here today, and putting ourselves at risk, all of us that are coming in contact with other people and trying to help them. We are on the front line, and we're operating at full speed to save our seniors. I hope you'll give this really serious consideration. We all have needs. I'm listening to all of you, and without a doubt, it is, as I said, an overwhelming situation. But we cannot let our seniors go without food. They're the ones who left us a legacy. So that's all I have to say at this moment. And thank you so much for listening. And I'll get off my soapbox.
No, we appreciate you, Ms. Bremner. Thank you for being here and letting us know how things are doing on your end. This has been a very informative panel. A lot of good information, a lot of, frankly, stark and disturbing stats, you know, but it's really exciting to see how well you all coordinate together to, you know, for example, reduce recidivism in our community and help out our mental health population. So we're cutting into our break a little bit, but I did want to open it up for questions from council. Do we have any questions for the panelists today?
I have a couple of questions for, is it Mr. House?
Yes.
Okay. So I guess that we're okay on beds right now. How are we on staffing?
So the question is, how are we on staffing?
So if we got another surge, do we have enough nurses and doctors to cover that surge?
So I would say, it would depend on how severe the surge was. So right now we are adequately staffed. The operative word there is adequate. One of the challenges we face in the Verde Valley is getting professional people to come here. Right. Nurses, doctors. So right now, if we had a surge, initially we would be fine. You know, depending on how severe it got, we could find ourselves short.
My understanding is a lot of our staff is traveling nurses, or I guess it'd be temporary.
We currently do not. We currently do not have a lot of travelers, unfortunately. Also, unfortunately, if you wanted to get travelers, it's very difficult right now. Right. One of the organizations that we use, the primary one that we use, currently has 20,000 outstanding orders for travelers around the country. 20,000. The other thing that's happening, again, this is the supply and demand. Right. Travelers are now demanding and getting 5 and 6 and 7 times what they would normally make to go someplace to work. So we don't have a lot. We're hanging on to the ones we have. We've got some orders in for some new ones, but we're probably not very hopeful that we'll get more travelers.
Do we have any arrangements or recruit out of, I'm told, Yavapai College has a nursing program? I don't know about NAU or...
Yeah, we've had an ongoing relationship with Yavapai College and you know, bringing new people in, and we're always anxious to try to bring in as many as we can. Right now it becomes a real challenge because somebody that comes out of a degree program, in this case Yavapai, but it wouldn't make any difference where it's from. You've got to spend time with those new grads, orienting them and making sure you bring them up to speed so that you can really have them be independent on a floor with patients. So with the demands we have right now with the COVID population, that makes it a little challenging, but we've had a great relationship over the years with Yavapai.
For the new recruits that do come in, do you guys offer any kind of cross-training for, I'm told, ICU, and the ER would be like a different level of training? Do you guys cover that if they're interested, or cross-train just as a backup?
Yeah, no, we have offered that kind of cross-training throughout. Again, the challenge is not a problem. The challenge is, and young people want this. They come out of school, some of them say, I want to go to work in the ICU. For us to prepare a new nurse to work in the ICU unassisted is probably 6 months worth of training. And you got to have somebody side by side with that person. They come out with really good basic skills, but not to work independently in an ICU. Good question.
I had a question, Mr. Newman, and your Reach Out Diversion program has shown great success, and I know you've got a lot of partners that help it be successful. With that reduction in recidivism and your track record, is there any opportunity to get some additional funding to help you know, some of your partner agencies like Spectrum and their mobile crisis unit? It seems like with that track record, is there any opportunity out there to get some funding?
That's a great question, and I think that maybe Ms. Rhodes could could speak to her agency and maybe the behavioral health partners. I know with that track record, we have had great success in getting grant funding through the Department of Justice, through access grants, and through philanthropic organizations like NARBA. So our Reach Out program currently for the last 4 years is 100% grant funded. And we have a little bit of funding that comes out of what we call our commissary fund, that we create revenue through commissary, which are commissary or things like inmates can buy extra food if they want snacks or whatnot at night. And all of that funding goes into a fund to benefit the inmates. And so we pay for part of that program out of there. So we have not had to spend any taxpayer money thus far on any of this Reach Out program because of the overwhelming support that we do get from grants. One of the big things that we were able to do, again, Sheriff-elect Rhodes has done through legislature over the last couple of years, is we've partnered with the governor's office, because Governor Ducey sees the success in the Reach Out program that we have up here in Yavapai County. And it's become known as the Yavapai model nationwide. And we have other agencies across the nation that have come to look at it. But the governor's office sees the benefit to taking some of the money that we have historically put on the back end of reentry for inmates coming out of prison and diverting some of that money onto the front end in the jails to work with programs that are able to reduce the destructive behavior or the risk factors of inmates getting out of jail so they don't reoffend and end up going to prison. So the governor's office has allocated quite a bit of money over the last couple of years to financing our program on a trial basis. And so that's been successful. That's been a very successful partnership as well. And we hope that there's some legislation again on this upcoming session in January that will renew some of those partnerships. So yes, the funding is there. Long story short, the funding is absolutely there because of the interest in reducing the recidivism. So I think that organizations, the behavioral health organizations, the partnerships we have there, I'm sure are looking at that, but cities and towns across our county are also looking at getting some of that help through the grant funding so they can start looking at creating positions that will address some of these factors. Because I know it may be a little bit more work on the front end with a release coordinator or somebody that's identifying these risk factors, but the success rate in not having someone victimized in our communities and having new prosecutions and whatnot is tremendous. And I've spoken with Dennis McGrain at the county attorney's office because I was curious if this correlated to a reduction in case files over the last couple of years. And he says absolutely. They have seen a reduction in cases that they've had to file on the felony level. So to your point, yes, there are partnerships available and funding available. And our entire program has been it's been grant funded, and we haven't had to pay for any of this out of taxpayer money in Yavapai County for the last 4 years.
All right, thank you, sir. Any other questions?
I had a quick one, and I'm sorry, I know we're running short of time, but this was for Ms. Rhodes, and I'm not familiar with how Spectrum determines or defines the crisis response events, but in the presentation, that number or the metric of the 296 individuals with multiple crisis events accounting for half of all crisis responses, that seems concerning. Do you have thoughts on how perhaps we as a community or working together can maybe address and bring that number of these individuals with the multiple crisis events down or somehow work to address that?
Thank you. The sound cut out on just the last part of your question, but I think you were asking if I had thoughts on how we could help reduce some of those kind of recidivism on the behavioral health crisis side. Is that correct?
Yes.
Okay, now I can hear you again. Yeah, so actually, interestingly, since we started the program 5 years ago and it originated in the Verde Valley, that number was much higher. So I think we've made a lot of strides in helping to reduce the number of people who are like repeat crisis events in the Verde Valley, just through getting the word out that they could call directly to crisis response or engaging them in services, and then being able to wrap around in their homes or in their communities so that they can receive services through a less emergent type system. So we've made a lot of progress there. I think, what we've seen in the Verde Valley just over the years too, is that there's a higher number, and this is true from a statistical perspective, that we have a higher, what they call at the Medicaid health plan level, a higher penetration rate in the Verde Valley of people living with serious mental illness. It's always run a little bit higher than the rest of the county. And so I think that, we're going to continue to see that number be a little higher in the Verde Valley, because when you look out over county-wide, that number of people who have those multiple crisis events is lower countywide. It's been, when you just pull out the Verde Valley numbers, then that's where we see, that 290 people accounts for over half of those events. So, I think it's just a community effort of continuing to get the word out, encouraging people to engage in services. Part of what the challenge is for Spectrum, for sure, is that our services are voluntary. And so that's, often the place where we run into conflict as well with the community, with family members, is that, people want their family member or someone they care about to get the help, but they have to ultimately choose to do that. Spectrum does not have an involuntary process. It's a whole other process to engage in through Title 36. But like I said, I think we've seen great success in driving down that number because of that mobile crisis response and that immediate part of what we bring to the area too, is that our services, we're a health home in the area. So we're able to immediately engage people in care, like next day, same day, with psychiatric services, with counseling, with things like that, versus in other systems where they may be disconnected, where you may have mobile crisis response that's having to connect with a different provider and not able to do that real time in the middle of the night, for example, or at Verde Valley Medical Center in the emergency department. We're able to immediately get people into care. So I guess I don't have any specific answers at this point, except for that I think the community has been really engaged in helping drive down that number, and we have seen a significant reduction.
I'm happy to hear that, and thank you for the information.
Thank you.
I can just add to that, as was stated earlier, our court and our police department have both been applying for grants for that extra person to help with some casework to help reduce recidivism and help with other issues. But I know that both Judge Kelly and Chief Gazelle have worked on trying to get additional resources.
All right, well, thanks to you all for this discussion. It was very, very informative. I appreciate all your time and all the hard work you do on behalf of our communities, so thank you for being here. And we're going to take a quick, just a 5-minute break so we can try to keep ourselves on schedule, and we'll get on to our next panel here shortly. Thank you.
Thank you.